Good day, everyone, and welcome to today's Best Practices for Planning a Community Event on Underage Drinking Prevention. At this time, all participants are in a listen-only mode. Later, you will have the opportunity to ask questions during the question and answer session. You may register to ask a question at any time by pressing the star and 1 on your touch-tone phone. You may also ask a question through the web by the Q&A box on your screen. Please note this call may be recorded. I'll be standing by if you should need any assistance. It is now my pleasure to turn the conference over to Josh Ferrari. Please go ahead. Your line is open.
Great. Good afternoon, everyone. Thanks for joining the first Talk They Hear You Partner webinar. My name is Josh Ferrari. I'm familiar with many of you on the call today. I support outreach and communications for the campaign. So today we'll hear the best practices for implementing the campaign from coalitions in Manhasset, New York, in Sacramento, California. Today's agenda will include a discussion on the Talk They Hear You brand, a partner presentation from the Manhasset Coalition Against Substance Abuse in Manhasset, New York, a brief Q&A session, a partner presentation from the Coalition for a Safe and Healthy Art Arcade and the Sacramento County Coalition for Youth, a brief Q&A, and finally we'll end on a discussion starter video guide overview and a feedback session for everyone to give their thoughts on the guide in the discussion starter video. So to kick us off, I'd like to introduce Robert Vincent, the federal officer responsible for the Talk They Hear You campaign.
Thanks, Josh, and welcome everybody. And a special thanks to our 3 coalitions that are working very hard today and have done great implementations. The Talk They Hear You campaign, who began its life in 2013, really has been built through the effort of every coalition and communities out there as we have continued to try to develop content and good programming collectively that resonates and works well for everybody. It is just I couldn't thank everybody enough for all of that. And we're hoping that the impact as we go forward of the campaign is positive for everybody, and would invite you and ask you to continue to provide us feedback as we go forward today. There are no wrong questions. We want to hear from you of what's working and what's not working. And with that, I'll turn it back over to Josh so we can introduce the team and move forward with today's presentation.
Great, thanks, Rob. So again, Josh Ferrari here. I do partnerships and outreach for the campaign. I'll pass it over to my colleague, Lindsay.
Hi, everyone. My name is Lindsay Young. I work with Josh on partnership and communications for the campaign. I will also be the face behind your chat and question and answers today. And now I will pass it over to Emily.
Hi everyone, this is Emily Springer. You might have seen my name on emails as well. I work with Josh and Lindsay on our outreach and materials development and campaign promotion, also communications measurement. So thank you for those who are on the phone who've submitted their metrics and some of their communication successes. We're just delighted to be here. And then with that, I will turn it over to Elaine Rabar, and she'll talk a little bit about the campaign brand and some guidance for each of you.
Hi, and thanks everyone for joining. This is Elaine Rabar. I am the project director for the campaign, so I work with everyone on the team and work closely with Rob and Nell to make sure that we're delivering everything that all of our organizations and partner organizations want to have in the campaign. And I'm going to talk to you in a minute a little bit about the brand of the campaign. So the U.S. Department of Health and Human Services recently trademarked the campaign. And what that means really is that now we are distributing licenses to organizations to use the campaign. And that allows us to track how the campaign is being used and to be able to better assist local groups and organizations such as all of you with all of the campaign implementations. And the trademark importantly helps us maintain consistency and trust among our target audiences, which elevates and strengthens all of our collective prevention efforts. One of the reasons we want to point this out today specifically is that we get questions from community groups like yourselves all the time asking if they can use the campaign because of the trademark. And our answer is a resounding yes. This campaign is for you, and we developed it, the government developed it so that groups don't have to reinvent the wheel when it comes to prevention campaigns. So we've done all of the heavy work in terms of the materials development and printing and customization, printing and coordination of all the materials for you. So you guys can use the campaign as it is, or you can certainly coordinate with us, and this would be where Josh would come in to help with some of the technical assistance. We have a repository of photos available to help you customize the materials. We can also share source files so that you can include your organization's logos and contact information, but you can certainly take the campaign materials as is and use them as they stand. So now I'm going to turn it back over to Josh.
Thanks, Elaine. So now it's my distinct pleasure to welcome Kathy Samuels, who's representing the Manhasset Coalition Against Substance Abuse in Manhasset, New York.
Thank you, Josh. So Manhasset CASA has been in existence since 2001, and it received its second 5-year drug-free community support grant in 2013. And of course, working under the Strategic Prevention Framework, we utilize specific strategies to change the community conditions where underage drinking exists. The Talk They Hear You campaign assisted our efforts from 2014 to 16 to encourage dialogue between parents and tweens to the dangers of underage drinking. And it was one of many steps that we implemented in the community to try to reduce underage drinking. But one of our first steps in developing the campaign was to really understand who our audience was and what would motivate them to engage in the goal of the campaign. And that goal was to talk with their children about the dangers of underage drinking. Knowing our parents' attitudes, values, motivation, and culture was key to developing the campaign. Here, our demographic happened to be an affluent Caucasian parent population with an acceptance of adult and underage drinking. Parents also embraced a healthy living culture where many were active on community health and environmental issues, as well as local yoga, exercise programs, community gardens, and drinking water initiatives. Parents also expressed a strong interest in their tweens excelling in sports and academics, and to expect parents to talk with their tweens about the dangers of underage drinking, we felt it was important and necessary for them to believe the benefit of talking with their tweens, so that's consistent with their high academic and athletic goals for their children. In utilizing the Talk They Hear You campaign message, it was clear to parents we wanted them to talk with their kids, but what should the content of that parent campaign message be? So we first crafted our campaign content to detail how underage drinking was unhealthy to the developing teen brain, as well as to the body, as it has a negative effect on athletic performance. In addition to marketing materials, we held community prevention education programs featuring high-profile speakers, healthcare experts, and law enforcement who complemented our messages. We provided parents with emergency room data, which confirmed youth between the ages of 12 and 18 were being treated and released from emergency rooms across New York State, and that would be for alcohol issues. And it showed parents that teens were not just drinking, but binge drinking, where it is life-threatening with severe consequences. Finally, from our biannual survey data, our youth had indicated they obtained alcohol with and without parent permission, and they also drank alcohol in the home with and without parents' permission. And so it was pertinent for us to also educate parents to the legal implications of hosting underage drinking parties, as it's illegal under our Nassau County social host law. And in addition, we also discussed civil liability was at stake for every household, as under New York State's general obligations law, you can be civilly liable for any injury or harm caused by a child that was served alcohol in your home. So again, that was falling in line with our binge drinking data results, and we also were very concerned and interested that they talk with their kids about our New York State 9/11 Good Samaritan law, where teens are encouraged to call for help in the event of an alcohol overdose. While having a clear message is essential, we also had to determine how are we going to deliver our message to parents. As a DFC coalition, we utilized key sector members from our school committee, parent committee, community committee, and the business sectors, as well as our town government, churches, civic associations. And each group had a unique contribution to the delivery of our message. So Manhasset CASA has always had a very strong relationship with our school district. We were founded back in 2001, and we were also in partnership for a very long time with our parent association, who not only helped us deliver our campaign materials, but they also helped us determine our campaign materials through our parent committee. So we were always able to go back to our committee and discuss the contents of these messages and to see which one made more sense for the campaign. The campaign, again, delivered a fall and spring prevention campaign letter. We did that in collaboration with our school district and the PTA. The campaign materials included a letter signed by our superintendent, our executive director from CASA, and the president of our parent association. We were able to utilize monthly e-newsletter. We do that through Constant Contact, where we would include Talk They Hear You parent communication tips, advice, as well as educational articles, where it was then distributed through our district to over 4,000 households. The newsletter also was distributed by our Greater Council Civic Association, which then in turn delivers it to residents within multiple neighborhoods. And just to note, we've sustained the Talk They Hear You message through our district's parent guidance nights, where we're able to continue to provide our statistics, as well as prevention parenting tools to assist parents in continuing to talk with their teens and tweens about the dangers of underage drinking. We kicked off the campaign every spring with a town hall style meeting, usually with a high profile speaker. The picture on the lower right features NBA star Chris Herron, who addressed parents and students regarding preventing social hosting and the importance of teens being themselves without using alcohol. These kinds of high-profile speakers are quite expensive, so we basically went out to our business and school community and asked people to partner with us to pay for the event. In years following, we had our county district attorney kick off our campaign and sit on a panel with other high-profile speakers in the prevention and treatment world. We collaborated again with multiple partners and funders to supplement our educational outreach and parenting tools. And as part of our continued parent education for the community, we now have Active Parenting Now, an evidence-based program offered twice every fall through our Manhasset Public Library. We engaged our 5th and 6th grade teachers and asked them to send home campaign postcards, Talk They Hear You postcards, via what we call Backpack Express. Postcards provided the Talk They Hear You website for parents to access tips for talking with their tweens. Messages here are very pointed to the fact that summer is here and often a vulnerable time for tweens to experiment with alcohol. At the same time, we placed ads in our local paper during the summer, as well as in December, which are peak times where SAMHSA has indicated tweens will try alcohol. Our parent committee volunteers canvassed businesses like nail salons, restaurants, and our library to post Talk They Hear You tabletop tents. We coordinated a fundraiser with our local parent PTA at a popular yogurt shop where it showcased our parent brochure and fact cards to customers. The fundraiser wasn't necessarily one to raise big dollars, as it was an opportunity to deliver our message where parents and tweens shop and eat. And our parent association also hosts an annual community fair where thousands of kids and parents come to every year. And that's the picture on the lower right. CASA provided direct access to parents, where we provided underage drinking prevention materials in a CASA backpack, and also placed a journal ad for the fair, which reached over 1,000 people. We developed a 4x4 window cling where parents canvass local stores to place on the store window, and we also took that same window cling and made it into a sticker and provided it to pizzerias where they posted it on top of the pizza boxes, and we did that during Memorial Day weekend, July 4th, and Labor Day weekend. And we did that again during the December holiday break. We placed ads on local supermarket grocery carts to advertise the campaign along with the SAMHSA website for Talk They Hear You. And we actually were able to go out a little further than just our Manhasset community. The store chain agreed to post our posters across all of its Nassau County and Suffolk County store locations. In addition, again, fact cards were provided to local businesses, the library, and town government locations. Our town supervisor and councilwoman presented CASA with a proclamation at the beginning of our campaign. We also recorded a public service announcement with our supervisor and incorporated it into our Prevention Through Connection educational television programming. And the town played the PSA throughout the year. Our public access station also plays the Talk They Hear You campaign messages throughout its day. So that it's also, again, a part of their commitment to prevent underage drinking as our partner. Whoops, went too fast. And in closing, I just want to relay the importance of taking pictures throughout the campaign as you engage your partners. It's great to use pictures as part of a press campaign to the general community. Pictures can be placed on Facebook, e-newsletters, and websites, and the images help build capacity and consensus in the community that many are working together to prevent underage drinking. The toolkits often have articles or the beginnings of articles that you might want to use, so you don't have to reinvent the wheel. And again, that toolkit provides great communication tips and advice that can be incorporated into the articles. In one particular situation, we approached other prevention providers like the Partnership at drugfree.org, and we asked if we could use their three-part series on alcohol, drugs, and the adolescent brain. So again, there's so many different tools out there from the campaign to other prevention providers where you don't have to reinvent the wheel when it comes to creating press for your campaign. And that's the completion of my portion of the webinar.
Thanks so much, Kathy. Now we'll go ahead and take questions for Kathy. So I'll invite the operator to come back online and explain the process to everyone on how to ask a question.
At this time, if you would like to ask a question, please press the star and 1 on your touch-tone phone. You may withdraw your question at any time by pressing the pound key. You may also ask a question through the web by the Q&A box on your screen. We can pause momentarily for allowing any questions to queue. And we have no phone questions at this time.
And if we have any questions for Kathy, we're going to give it another 30 seconds, and then we'll move on to the next presentation. Okay, great. So we will go ahead and move on to the next presentation, but if anyone does have any questions for Kathy that you think of at a later time, you can feel free to email us at underage.drinking@samhsa.hhs.gov. And so now it's my pleasure to introduce Joelle Auric from the Sacramento County Coalition for Youth and Jessica Fielding from the Coalition for a Safe and Healthy Art and Arcade in Sacramento, California.
Hi everyone, my name is Jessica and I have my colleague on the phone, Joelle Auric, and we are both preventionists from Sacramento County. I am DFC funded and I represent the Coalition for a Safe and Healthy Art and Arcade, and Joelle is county funded through SAFT funds and she represents a county grant. And we both initiated both of our coalitions actually in 2015. And at 2015, we were both really in a planning phase as to what was the coalition going to look like that we were both launching. And both of us, we realized that we really needed to tap into our parents and caregiver area. And that really initiated with us doing a focus group, which is something that the Sacramento County Coalition for Youth led with a group of students from all around Sacramento County. And the students consistently said that the number one thing that really mattered to them as far as if they would drink or not was their parents. And that really launched the initiation of us looking at what campaigns are out there, or do we start kind of from scratch. And so in 2016, we both decided that we were going to collaboratively launch the Talk They Hear You campaign. I had actually heard about it from CADCA, and I had seen some just amazing work online, and it was something that we were really intrigued and said, what would it look like if we brought it to Sacramento County? And so that really launched us working with our different coalition members. Collectively, both of our coalitions have 103 members across Sacramento County. And so we work from everybody in the school district to law enforcement to healthcare, but our biggest goal was how do we get this great information into their hands. And so both CSHA and SCCY began to meet individually monthly and begin to talk to our different partners because we are in two different sides of the county. And we began to plan the campaign and really met with our different stakeholders and decided that this is what it would look like once we launched it. And we're really, really glad to say that the results were extremely impactful. And I think it's just because the Talk They Hear You campaign is just really produced in a way that's really easy to implement within your community. And so we actually localized the products. We localized the products before they were trademarked, and we actually met with a local PR organization that has a lot of influence in Sacramento County and has a lot of influence also with stakeholders in the region. And so what we actually did in coordination with SCCY is us and the PR organization, we created posters, billboards, brochures, palm cards, transit shelter signs, interior bus shelter signs, and refrigerator magnets. If you see the slide right here, this is actually the front of one of the brochures that we produced, and on the right side, that's Keep Asking, Keep Talking, Talk They Hear You magnet that we actually created, and palm card for different community members in the region. And we passed out all this information countywide. The next slide is actually our Talk They Hear You brochure, and we implemented a lot of information from the campaign and really just localized it with some of our information. But our message was consistently that parents and caregivers are the most powerful influence on their child's behavior. Our biggest goal was really to empower parents and caregivers that they have a voice and that they should really talk to their children about this manner. And next up, I'll introduce Joelle Auric, who represents the Sacramento County Coalition for Youth.
Great, thanks, Jessica. So as Jessica mentioned, we work with our local PR firm, and one of the things that they did for us was to create a landing page for each of our coalitions so that when people were directed to our website through the various outreach methods and materials, like Jessica mentioned, we had brochures and billboards and bus signs. They all had our website addresses on them. So when folks were directed to our website, they would immediately be able to have access to the campaign. We all had links on pages to several of the Talk They Hear You handouts and materials, so parents and community members could just click on these links to receive resources and tools, data, and then some of those great handouts about when to talk and why to talk and how to talk to your kids. Our local PR firm also created social media posts for us, and this was so helpful. So many of our coalition members have social media, as both our coalitions do and our parent agencies, but no one really had the time to create regular posts. So the posts that our PR firm created for us were brief, but they all had links to additional information, or they linked to one of the PSAs, or they had videos that enhanced the message. And this really helped extend our reach into the community and provided something measurable that we could look at on outreach. As we prepared for our presentations out in the community, we held a training for our coalition members to train on the campaign, review our local data and materials that they would share with parent groups throughout the community. So both of our coalitions held trainings, and following the trainings, our coalition members asked for more. They didn't really feel ready to present on their own. They're not all preventionists. They're not all in the field. Many of them, there are parents or students. Some are in related fields, but some are just folks that are interested in this type of work. And so we really wanted them to feel confident in presenting and sharing the campaign with parents in our community. So we had one of our trainers then video a presentation and then shared it with them at both of our coalition meetings. So folks could see what a presentation could look like, and I think this really helped them and alleviated some of their fears. We also decided we wanted to have a big campaign kickoff, something to initiate and introduce the campaign to our community. We planned it for April 6th in conjunction with Alcohol Awareness Month, and we held it at the Sacramento Zoo, somewhere fun, somewhere family-oriented, a place where parents could really think about beginning to have the conversation with their kids. It's never too early to start. So our event was called Keep Asking, Keep Talking, and it was designed to get the word out in the community that this campaign was up and running. To prepare for our kickoff event, we reached out to local dignitaries, city and county leaders, media, students, parents, law enforcement, and community-wide organizations to support and to attend. We also worked with some of our municipalities. We have several smaller cities in Sacramento County, so we looked to them to deem April 6th Talk They Hear You Day in their county or in the city. And we received resolutions from the Sacramento County Board of Supervisors, the City of Sacramento, and some of the smaller cities, Rancho Cordova and Elk Grove. We also had certificates of recognition presented by our local senator, assemblyman, and congresswoman. So at the event on April 6th, many of these dignitaries came and presented the resolutions and certificates of recognition, as you can see in the pictures. We also had students and parent speakers. The chief of police came and presented and representing local law enforcement. Education folks came and presented, and other community leaders. So we had also a strong social media response, and we generated that through our PR firm again, and our campaign went live. As Jessica mentioned, so this is a little bit what it looked like. These are some of our billboards. We had signs, interior bus signs in our buses and our regional transit shelter signs. We had a strong social media presence. And we had articles and ads in local newspapers and magazines, in the Parks and Recreation guides. We created, as Jessica mentioned again, brochures, our palm cards, and magnets. And then we distributed those at hundreds of community events, including schools. In addition to our outreach strategies, one of them was to look to getting our PSAs shown in our local movie theaters. So we contracted and paid with 6 local movie theaters, and they all have multiple screens to show the DADS PSA throughout the spring. We also paid to have our posters hanging in the lobby of the theaters. So again, folks would see the PSA when they went to the movies, and then when they went out, they would have that, again, recognition through seeing the posters in the lobby. They also have TV screens in many of the lobbies where they post messages. So we paid also to have our messages post there. Just the more reminders that we can, so to parents to talk often with their kids. So initially for our campaign, our plan was to run through the spring, April through June, during some of those risky months where we have proms and graduation and the entrance of summer. And the response to our campaign was so positive that our coalitions decided to continue the campaign during the back-to-school months of August and September. So our local PR firm who we worked with, who creates our social media, they pride themselves on being very creative, and so they encouraged us to try something new. So we recruited a few of our coalition members to work with the PR firm to create some short videos that they would talk about the campaign from a parent and community member's perspective. So these videos were created and then shared with our coalition members to put out on social media. We were really happy with the results, and we want to share a couple of those videos with you right now.
I mean, I think it's, to me, if coming from an Asian culture, we don't talk about anything. We kind of go off and are expected to perform, not make mistakes, and do what we're told, and not really fit outside the box. But I think if parents were to kind of go away from the tradition of not talking, especially my culture, and just kind of asking and protruding into someone's life, especially your own child's, I think it's necessary. I know it's uncomfortable, but once you get past the uncomfortable, there's a whole nother realm to cover. I think the connection, the relationship just exponentially grows from there. Talk. They hear you.
With my son, he's an athlete, he plays a lot of sports, so he and I talk about nutrition. How do you stay fueled up so that you have enough energy to play well? Wear sunscreen when you go out. But one of the things that we now also talk about is underage drinking. And it's become that norm of these things of how do you take care of yourself. You wear sunscreen, you eat well, you stay away from drinking, and it's because it's going to impact you as an athlete too. So I just give a tip also, and really thinking about what does your son or daughter care about, and finding a way to link that to that conversation, even when you feel uncomfortable. And the more you talk about it, the more normal it becomes, and the easier it is to have that conversation. Talk. They hear you.
Now I'll turn it back over to Jessica.
Awesome. Well, with the launch, we, and us really empowering our different coalition members, some of the coalition members that you saw in the video were just really big champions of the cause that we were trying to create in Sacramento County. And because they were so empowered and just so motivated to go into their community and to share the message of Talk, They Hear You, we were actually able to do 111 group presentations throughout Sacramento County. If you see the map on the right, all of those blue dots actually represent a different presentation that we did in Sacramento County. And through that, we reached 6,013 individuals that actually sat down and heard the message, grabbed the brochures, and just heard from a champion for the cause of Talk, They Hear You. Next up, we actually have our reach and impact. This is new data that we actually recently received. Through social media, we had 15,714 hits. As I mentioned, we had over 6,000 individuals reached via presentations. But what is really impactful for us is that all of the impressions via the billboards, the transit signs, the internal transit signs reached over 3 million people. And we're just really excited to see that people were hearing the message, they were looking at it, they were going online, and they were being educated on this very important manner. This next slide just shows some of the impressions that we made. Again, this is a map of Sacramento County, and to your right, you can see the different colors represent areas that we reached either through transit, billboards, theaters. And what's really exciting is that you can see some of the areas overlap, and those were areas that we were definitely trying to reach out. We published different Talk, They Hear You messages on a parent magazine, a Sacramento magazine, on several different park and recreation magazines in Sacramento County. As Joelle mentioned, we have smaller cities that are within our county, and so we actually met with their park and rec department and requested that either our Talk, They Hear You message be printed on their sports magazine or within their community center, and many of them did that welcomely. We actually ran an ad as well on Friday Night Lights, which is a magazine for football games. Local football games in a city called Folsom, and our biggest message was how do we get it out to everyone in Sacramento County with us being such a large county. And then next up is just some lessons learned from our implementation. And our first lesson learned that we can definitely encourage people is that obtaining media attention varies on which events are occurring in your community. The day of our launch for Talk They Hear You at the Sacramento Zoo, the night prior there was actually an arson incident at one of the local middle schools, and we did have several we had a lot of media attention that day, but because of the fire, unfortunately several different TV stations went to that fire, and we didn't get too much attention on our actual day at the Sacramento Zoo. And then just our lesson learned number 2 is that marketing groups, because we did reach out to a PR firm, they are definitely experts in media and communication development, and like our PR firm had a lot of influence in Sacramento County, but they also needed guidance with prevention language and strategies, and we continuously had to really get them back on course as far as, this is the science of prevention, this is what we're trying to do in Sacramento County. And once we got them on board, they were completely empowered really to do the work with us and alongside us as well. And then Joelle would like to share some info on lesson learned number 3.
Yeah, the last one was our coalition members will take ownership of the project when they can implement the campaign at their organization and within their communities. As I mentioned earlier, they're not all preventionists, and so for us it was really important to listen to them and to engage with them, to train and support them throughout the process. I think our campaign success really benefited from the representation that our members have from so many communities in our city. And so we always want to look for opportunities to engage them, to bring them to trainings with us, or to invite them into events or activities we have with our organizations. But just always looking for ways to support and engage coalition members and look at their reach really help to extend ours. So with that, we want to close our portion of the presentation. Thank you so much for hearing about our campaigns, and we'll move to questions and answers.
Thanks, Joelle and Jessica. Operator, we're going to go ahead and open the floor for questions.
And at this time, if you would like to ask a question, please press the star and 1 on your touch-tone telephone. You may withdraw your question at any time by pressing the pound key. Once again, to ask a question, please press the star and the 1 on your touch-tone phone. You may also ask a question through the web by the Q&A box on your screen. We will pause for a moment to allow any questions to queue.
And Joelle and Jessica, we have our first question from Tiffany Hall. And the question is, how was all of this funded?
Yeah, that's a really great question. I represent the Coalition for a Safe and Healthy Art and Arcade, and we are a drug-free community grantee. And so our funding comes directly from the federal government, and it really empowers us to do campaign work in the region. Joelle can share a little bit more about her county funds. She is SAFE funded.
Right. Our coalition, like I mentioned, we're pretty new. Our coalition in the previous years in Sacramento County, our SAFE funds for prevention just funded prevention providers to work on a little bit more of an individual prevention basis. And we have a big county, and we don't have that many providers. And so one of the things that our county decided was to create a coalition to really help to, 1, include more community folks in our prevention work, and 2, to really look at environmental change and what type of strategies we could implement that way. So the coalition is funded through SAFE funds through our county Health and Human Services, and being beginning, early in the coalition's existence, we had funds to expend to pay for some of the outreach and the media.
Great, thank you. And we, as a team here, have a few questions for you all as well. So, and this is a question for you all, Joelle and Jessica and Kathy. If you want to chime in too, we'd love to hear from you. But do you all have any tips on related to how you track your success of the campaigns? I know there was a lot of talk about evaluation in the presentation.
This is Joelle, and I'll just jump in really quickly. I work out of the County Office of Education, and we have an evaluator in-house. And when we first looked at creating our budget for the coalition, that was one of the first things we did is connected with them and included dollars for evaluation, because this was new, again, working on campaigns and community-wide efforts, and we wanted to make sure we would have a way to track that. So we contracted with our evaluator here at the County Office of Education, and obviously she did a really great job, and she also worked really closely with our coalition. She came to our meetings and heard our discussions and was part of our planning, and so knew what we wanted to do, and so really helped kind of from the ground up help us create ways to measure what we wanted to do.
And Josh, go ahead.
I was just going to say our evaluator is actually the same evaluator as Joelle's. She's more extensively connected just because they're at the same facility. But yeah, she's just a phenomenal evaluator and just provides us with a lot of tips on how to accrue the data that we actually need.
We have utilized our parent committee, which is formed with key representatives from different school buildings, parent associations. So we had this built-in kind of sounding board, and we were able to tap into them to get feedback throughout the campaign. We also, as part of our parent survey that we do, we asked some questions specific to whether or not parents were talking with their kids about the dangers of underage drinking.
Great, thank you. I think that's all useful information for everyone on the call today. And Kathy, kind of touching back to the groups that you've worked with, do you have any tips for approaching the local businesses that you've worked with or the local government entities, and sort of any best practices related to that you could share with the group?
You know, I think most people want to help kids grow up healthy, especially in light of today's heroin and opioid epidemic that we're experiencing. And I think that if we can find ways for people to contribute to the campaign that you know, they feel that they're useful to campaign. So it sometimes gets creative in knowing your community, knowing your town government, knowing when to approach people. So for instance, definitely not in and around Election Day or any kind of contentious, you know, issue that's going on in the community. You know, sometimes that timing is very important in approaching anybody. So that, again, if you know what's going on their side, you can strategically approach people to kind of, you know, help you out on your end. But most people wanted to help. Most people want to put a picture or a poster for an event or a window cling. And again, our taxi cab company were so helpful. They put the cling on every single car and fleet in the community. But the other side of the coin is there will be disappointments. We were trying to get bumper stickers or the window cling on our buses. We wanted for the bus to roll up and parents to, you know, send their child off and see the window cling, but it turned out that there was some sort of federal regulations regarding placement of items on, you know, buses. So our school tried to help us. It didn't work out, but, you know, again, you move on to the next idea to see, you know, what might work to reach parents in another format.
Thanks, Kathy. And we actually have another question from Tiffany Hall, and I believe this is catered to Joelle and Jessica about your evaluation of the campaign. She's asking, what's being measured? Is it the reach? Is it the change in attitude pre- and post-campaign? She mentions that she heard you all talk about how parents feel more equipped or not, and so she's just wondering, how are you measuring, what are you measuring with the campaign, and how are you administering these surveys or evaluation efforts if you're doing so?
Go ahead, Jessica.
Okay, and then you can totally chime in, because our evaluation, something that we're really looking at is, well, really why the campaign launched is when we looked at a California Healthy Kids survey, which is a statewide survey that schools have the option to opt in or opt out of, which our school district locally actually does. We saw that less than 50% of students actually reported that their parents or caregivers were having the discussion about the negative effects of drugs and alcohol with them. So it wasn't a common everyday, even every month, every year conversation. And so something that we're really trying to evaluate is that increasing? Are more parents having the conversation? So something that our coalition is definitely tracking is the reach as far as everything from social media to billboards to items like that. And then we are keeping an eye out on our California Healthy Kids survey that is only administered every 2 years. So we're hoping in the next 2 years to see an increase in that. And then we also, our coalition specifically has a parent pledge where parents can actually pledge that they've talked to their child about not using alcohol and the dangers associated with that. But I do know that SCCY, I believe, evaluates a few other items. So maybe Joelle can chime in on that.
You know, what we've captured so far, like Jessica mentioned, are just the reach numbers because we're still new in gathering. We did not do a pre and post campaign, but like Jessica said, we do have our California Healthy Kids survey data, and then we're also working really closely with the schools in conjunction with some of the relationships and programs that some of our coalition members have going on in the schools. And so we will look at doing some pledging for parents and then posting the list of those parents who pledge so we can kind of capture some baseline and go from there. But we're, again, really early in this, and so we've not really been able to look too much of change of attitude. I wish we could. I mean, I hope we can, too, as we move forward, and it's exciting. One of the things we did do recently was we've been asking, have you heard from parents that have talked with their kids? And we're getting some really great summary data back like that from parents who have talked to their kids in certain situations and how that worked out and that type of stuff. So it's exciting so far.
Manhasset CASA did not do a pre and post test in terms of parental attitudes, but again, our measurement was really how many parents were talking with their kids through our parent survey, as well as on the student side. And we were as high as 95 to 100% of our parents were talking with their kids about the dangers of underage drinking. We were also able to track our website hits as well as our Facebook posts. So we would see some strange activities on Sundays. And we had placed also our advertising in our local bulletins, church bulletins. And so what we would be seeing is on a Sunday, it'd be a lot of activity going to the website. So we assumed that was because of the ads that were placed in the church bulletins. So I think the county side is a little bit more sophisticated than our small coalition was in terms of evaluation. So I hope that's helpful.
This is Elaine Robar. I wanted to thank both of you, all of you, for sharing all the evaluation information. It's really wonderful to hear. And we definitely want to follow up conversations and make sure that we're capturing all of that in terms of our larger campaign evaluation effort. I just wanted to take a minute and let everyone on the call know that the Talk They Hear You campaign is undergoing a larger scale evaluation effort for the campaign at large. We are currently in the implementation phase of a control and intervention site case study. So we have 2 sites that we're working with where we're doing, as we speak, a pre-survey for one of our sites, and we'll be doing a post-survey with both of the sites at the close of the implementation period for the campaign for the intervention site. And then along with that, we are also in the process of developing the OMB package to do a national evaluation for the campaign. So all of the evaluation efforts that we are discussing and looking at for the campaign are reported in the Chapter 5 of the Underage Drinking Prevention Report to Congress. If you guys haven't seen that, it is available online. It would be available on the stopalcoholabuse.gov website. unfortunately, that site is currently under maintenance, so if you go to it, you're going to get a message that says it's currently under maintenance. But we can send you the information and share the report to Congress so that you can see, because we do talk about the evaluation in it. The evaluation is part of the Stop Act legislation, so we are mandated to do the evaluation. So I just wanted to share that and make sure that everyone knows that it is something that we're doing, and we definitely are excited to hear about the local evaluation efforts that are happening.
Great. Thanks, Elaine. And I just have one final question here for Jessica and Joelle. I know that you adapted the campaign with the local PR firm, so we're sort of wondering, we're always looking to improve or make materials more relevant for different communities. So what drove you all to adapt the campaign in the way that you did?
I think for us, and Joelle can definitely chime in, they're a consulting firm for us already. I actually work out of the Sheriff's Community Impact Program, and so they focus a lot on social change, and I think a big reason we went with them was just because of the influence they have on our community as a whole. They are highly connected to a lot of stakeholders in the region, and meeting with them, we went through our individual coalitions plans and a few different strategies that we had. When we brought up Talk They Hear You, originally it was, believe it or not, Talk of the Town before we fully heard about Talk They Hear You, because we just knew that we really wanted underage drinking to be a conversation that was being held in the community. And so when I found out about Talk They Hear You, I just fell in love with the project and fell in love with what was going on. So a big reason for us with going with that consulting firm was just their influence in the community, and just trying to really localize the information so that it looked a little bit more like Sacramento. A lot of Sacramento, it's a pretty progressive region where a lot of attention right now is given to like the arts and entertainment, and so we just really partnered with them to try to get a little bit more of that feel, that artsy Sacramento feel. And I don't know if Joelle can chime a little bit more in as well.
Yeah, the only thing I want to add to that is Sacramento is, as a county, is extremely diverse. And I love how the Talk campaign has different materials that allow for that diversity. But as we were looking to create a single material that we could use for our movie theater posters and our billboards and our campaign signs, we needed something that as a single material would be reflective of that diversity. So that's one of the reasons we created that. So again, it would be a constant, the same picture, the same reminder to parents as they see it in different venues and locations. So that's one of the other reasons we did that.
The reason why Manhasset moved to the Talk They Hear You campaign, we had just come off of the Parents Who Host Lose the Most campaign, which presented a lot of pushback in the community for the main reason that within this particular community, Parents Who Host did not lose the most. There were no consequences for parents who hosted hosted underage drinking parties. So what we saw in the Talk They Hear You campaign, it was less finger pointing and more about the relationship with your child in providing them, with guidance for navigating, dangerous times in adolescence. And again, it was in many ways a savior for us because we had to change that dynamic within the community about alcohol being okay and safe for kids. So Talk They Hear You was a great message all around and brought people to the table as opposed to pushing people away.
Thanks, Kathy and Jessica and Joelle. I know we're coming right over the edge here on time. Oh, go ahead, Rob. I was actually just going to welcome you to the call to give some more remarks.
Well, and if I may, I would like to pose a question to our three coalitions and certainly anybody else out there that's listening. One of the things that I haven't mentioned just yet, just because we're working on the fundamentals of what this could look like, But Talk They Hear You has primarily been focused on underage drinking since its inception as it comes out of the STOP Act. One of the things that we were the beneficiary of this year is our Center Director, Fran Harding. We got a small bonus of some additional money and some ability to translate the campaign to other substances. And Elaine, Josh, and the team are frantically working to do sort of the initial market research on an environmental scan on what some of that might look like. But the question I would have for some of you is, do you have thoughts about substances of abuse, if it's a good idea, bad idea, just some general ideas around as we consider expanding the campaign to other substances? Could be prescription drug abuse, could be opiates, it could be marijuana, it could be a number of things.
Well, this is Joelle, and I'm really excited to hear you say that because we are, our coalition is just now taking on the marijuana issue. With legalization in California, it's scary, and there's not a lot of information out there for parents, and that's the first place we want to start is educating parents on the law and the substance as it's currently much different than it was when parents were young. And so I am really excited to hear you say that, and so my first push would be marijuana.
I agree. This is Jessica from Sacramento. Just same enthusiasm. I think what I really love about the Talk They Hear You message is, like Kathy said earlier, it's a really empowering message. It's not pointing the finger at, you know, this needs to be done, but it's empowering parents to really be the positive influence and the main influence in their child's life. And so whether that's with marijuana or prescription drugs or opioids or whatever, like the message is the same, is that parents are empowered to make a change and to have the conversation and to have the knowledge. I think as well, sometimes with so many different changes in drugs, for instance, marijuana use, sometimes the knowledge isn't there just because it has changed so rapidly. So empowering parents is a great thing. I'm excited to hear that's going on as well.
Yeah, I agree. To have, it's almost like one-stop shopping, if you will. One of the things that we were constantly going back and forth with was our Lock Your Meds campaign, and then we'd go, like, we call that our fall campaign, but we'd still keep Talk They Hear You on everything. But if you have a generalized message for all of the drugs and very targeted, that just solves the dilemma at the coalition table, you know, especially to implement and administer, you know, how many different campaigns do we have to have, you know, on marijuana or prescription drugs? It just keeps it simple. Maybe make the marijuana one green, the prescription drugs orange. You know, it's just a little creativity there in terms of what you're talking about. And people, you know, again, the marijuana is probably the most needed piece because parents are desperate to understand what in the world is going on there. And I think there's a lot of confusion, certainly on all issues, but marijuana, I think, is going to explode in the coming years if it hasn't already.
I thank all of you guys. I've impacted our discussion starter guide conversation, so I'll apologize if we run over for a minute or two here, but I just wanted to ask the question. Josh, back to you if you want to lead us in the discussion starter of the new product.
Thanks, Rob. I think it was a great discussion, so thanks to everyone for actively engaging. And if you have anything you'd like to add to that conversation, please feel free to email us. Again, the email is underage.drinking@samhsa.gov, and that's in the Q&A box as well on the screen. So with the few minutes we have left on the call today, I'd just like to run through the latest campaign resource, which is the Discussion Starter Video Guide. And we sent this out ahead of the call today. We sent it out yesterday morning to everyone who had registered for the call, but if you did not receive it, we'll be sending it after today's webinar as well for you to review. But the guide is a resource for community groups and coalitions, much like everyone on today's call. It includes an overview of the video, the discussion starter video, and how it can be used in local communities. It's meant to inspire coalitions with examples of how the video can be used, such as during community meetings, graduation ceremonies, and PTA meetings, among a few other examples that we've included throughout the guide. It also includes presentation tips based on your time available to present, as well as a list of other campaign products and SAMHSA resources, like the Talk They Hear You mobile application, the campaign soundtrack, and various databases for local and national statistics on underage drinking trends. And so we do have a few minutes left on today's call. We'd love to hear some feedback from everyone. If you have some quick feedback, we'll take it through the Q&A box on the screen. Otherwise, feel free to email us again at underage.drinking@samhsa.gov. I'm not seeing anything come through. So, Rob, I will pass it back to you for closing remarks.
Sure, thanks, Josh. And let me, we're missing one piece. It's quite possible that the problem you're having with that is it's underagedrinking@samhsa.hhs.gov. So we inadvertently dropped the HHS, so apologies there. With that, I would like to just thank everybody for your time today. The campaign really, as I said earlier, has always been built really from the ground up for our coalitions, and I would thank Emily, Josh, and Lindsay, and everybody who's worked on this. We've taken a focus to really try to make sure that the products are very high quality. From an expenditure perspective, to be honest with you, I'll hold out for quality every day, because at the end, some of the feedback that I heard from some of you guys sort of validates that thinking a little bit. The better job we do, the easier it is for you to take that product out there and to get it in places where we want it and need it. As we go forward, I would invite any of you at any time to engage with us. Please feel free to reach out to Josh. This year, we've got 3 new PSAs in the pipeline, and we'll be translating a lot of new materials to other substances. And so we would invite your input to the degree we can do that, and that you're willing to offer that. We would thoroughly appreciate your feedback as we go forward. And I would be remiss in not thanking my colleagues, my federal colleagues, both Nell Nadal, who I often refer to as my dancing partner in this little event, who's my alternate on this contract, but also the entire team from Synergy Enterprises. They've done a phenomenal job. As we go forward with this evaluation, I think we're all excited, and probably just a little anticipation, and I don't want to say fear, but would just say that we are undergoing a national evaluation. It is an important time, and we are, with some hope, trying to create an evidence-based practice for you in the social media campaign, but in the public awareness space for folks. So with that, I would just deeply thank you, and this is our first stakeholders meeting, and Josh, correct me if I'm wrong, I believe we're going to do this on a quarterly basis?
Hi, this is actually Elaine. I just want to clarify. So we are going to do them on a quarterly basis, and I do want to clarify for the email address, though, it is underage.drinking@samhsa.gov. Rob, just to clarify, the HHS one does not work, so it's the samhsa.gov one is the one that's working. The one that is in the chat box and the one that's in the video, or in the presentation. So just want to clarify.
Okay. Thank you.
And no, thank you. And then so we are going to be doing these quarterly. So we will have our next call in February. So we'll send out some information about that in the coming months. We will also be sharing the slides via email after this call, and some of the other materials that were referenced, so the report to Congress, for example, so you can see more information about the evaluation. We thank you all for joining us for our inaugural call. We were really excited to have it and hope that it was informative for everyone. And if you have feedback on the discussion starter guide, we definitely welcome hearing from you on that guide. So thank you, and I hope everyone has a great long weekend.
I believe this concludes our call today. Thank you, everybody.
Thank you.
Awesome.
Thank you.
Thank you.